Welcome back to TV5 News at 9. When cancer returns after a period of remission, it's called a recurrence. How likely cancer is to recur depends on the type of cancer someone has. Even the thought of recurrence can be stressful for some cancer survivors. Calling in this morning just to tell us a little bit more, we have Dr. Hani Al-Halabi. So thank you so much for being here, Doctor. How are you?
Good. How are you?
Doing great. Yeah, thanks for being here. Can you start us off with how common are cancer recurrences?
I think it's, as you said, it widely varies, and it really depends on the type of cancer a patient has, the diagnosis, stage of the diagnosis, and often the kind of treatment that the patient has received.
And can you speak to the importance for someone who has already had cancer and about their regular screenings and the frequency? Is it different for cancer survivors?
Yeah, I mean, I always tell my patients that the follow-up is a part of your treatment plan. So it is essential that patients stick to their follow-up schedules and do the tests and the scans that are requested for these follow-ups. Most recurrences happen in the first 1 to 2 years after you treat the cancer. So we normally follow patients more regularly, more frequently in the first couple of years. We usually see patients every 3 to 4 months in the first couple of years. Then that spreads out to visits every 6 months or then annually as you go further away from the diagnosis and treatment.
And also, treating a recurrent cancer with radiation can be risky for patients with recurrences. Why is this, and how does it play into our proton therapy as a radiation option for these patients?
So when we treat patients with radiation, we focus the high dose of radiation on the tumors. But ultimately, in the area you're treating, the normal tissues and organs do get exposed to some radiation. Now, for any given part of the body, the organs and normal tissues can only tolerate a certain amount of radiation over the patient's lifetime. So if you're treating the same area again, you can potentially exceed the tolerances of these tissues that can cause serious damage to these tissues, which ultimately manifests as side effects and complications. With protons have the ability to stop or basically deposit most of their energy inside the tumor, and that decreases the amount of radiation exposure to tissues beyond the site of the tumor, the disease. Whereas with photon radiation, which is the normal radiation that you usually have, the standard radiation, the beam continues to deposit its energy as it goes through the body. So these physical characteristics of protons can really be beneficial in the context of free radiation, because by maximizing the amount of normal tissue and organs that you can spare, you're more likely to be able to deliver an effective and safe treatment again.
Nice. Helping quality of life for patients, I presume.
That's ultimately what we want, right? If we're going to retreat a patient, we want to be able to do it safely.
Perfect. Dr. McLaren Proton Therapy Center is only one of the 2 in the state to offer this treatment. How can someone newly diagnosed with either a recurrence or maybe a brand new cancer find out whether this proton therapy is an option for them?
Yeah, I think, not every case with a recurrence is suitable for proton therapy. There's a lot of factors that would weigh into the magnitude of the benefit that you can get with the use of protons in a patient who already had radiation previously. So I think it's essential that patients have a careful evaluation to really determine if it is the right treatment for their case. So I urge patients to request an appointment at a proton center, speak with a proton therapy expert, and really understand their options and determine if this is the right treatment for their disease.
Yes, perfect. Dr. Halabi, thanks for joining us this morning, calling in with this great information.
Thank you.
You're very welcome. And for you at home, you can find more information by going to our hot link section on WNEM.com.